We are going to present to you a case that demonstrates how iris simulation might be an alternative for the solution of severe iris defects. We are going to present a case that illustrates this potential of modern keratopigmentation techniques in the correction and/or treatment of functional eye disability. With this study, we tried to investigate the functional and cosmetic benefit obtained by modern keratopigmentation techniques in cases of functional eye disorders related to iris defects using modern techniques such as intralamellar keratopigmentation with particular instruments, femtosecond-assisted keratopigmentation, and superficial automatic keratopigmentation performed with particularly new devices. This case report illustrates the potential of these techniques in the treatment of functional eye disability. I'm going to present to you particularly femtosecond-assisted keratopigmentation. Femtosecond-assisted keratopigmentation has been used in this case to create circular tunnels at the middle of corneal stroma using a 60 kHz femtosecond laser intralace for appropriate lamellar dissection and to recreate the iris tissue. The clinical case is a 23-year-old female patient that was referred with an essential iris atrophy due to iridocorneal endothelial syndrome. She was complaining of progressive and incapacitating photophobia, night glare, and monocular diplopia. The distance-corrected visual acuity was 0.8, which is 20/25. This is the one-year progression of the disease in which we can evolution of the problem and the association of this anatomical defect of the iris to the progressive eye disability and functional problems of the patient. We decided to perform femtosecond-assisted keratopigmentation using a new type of micronized mineral pigments created in Spain. This is the surgery. We created a 5 mm pupil tunnel at 250 microns depth inside the normal cornea up to 9.5 mm external diameter using the R&D module of the intralace. In order to clear up the central pupil area, we are creating two paracenteses to adjust the anatomy of the iris to an adequate function of the patient. Here, with the macroincisional scissors, we are cutting and extracting the residual iris tissue, and now we are going to open the tunnels created by the femtosecond laser. We are using now the keratopigmentation spatula to dissect circularly the cornea, and here we are making room and enlarging towards the periphery this pocket in order to recreate better the iris tissue and to prevent in the postoperative the visual disability of the patient. We are now injecting the dark brown pigment that was created for the purpose. This pigment is customized to the iris color of the other eye of the patient, and this is the end of the surgery in real time. The patient did very well, and this is the postoperative appearance at 1 week. No signs of inflammation, and particularly the patient was happy and with no functional disability. 3 months after surgery, her visual acuity improved to 1.2 with complete elimination of the photophobia, diplopia, and glare, and she was also very happy with the cosmetic outcome. Normal life had been reassumed by the patient completely. This is the pre- and postoperative binocular aspect of the patient, and we can really observe the very nice matching of the color associated to the functional improvement of the patient, and this is the particular aspect of the eye affected by the problem pre- and postoperative 3 months after surgery. In conclusion, keratopigmentation has proven in this case to be very effective and safe surgical technique for the correction of visual dysfunction related to iris defects that could be accompanied with a relevant cosmetic impairment in the patient. This is a minimally invasive technique and has resulted in a significant decrease in the subjective glare and photophobia and diplopia in this case. The cosmetic result was outstandingly good as appreciated by the patient, and in this technique offers a good option for functional correction of severe disabilities caused by different iris defects in the future. Thank you very much for your very kind attention.